As we talk about ways to support access to our mental and physical health, which we've done, telehealth is a huge asset. Senator Harris, you were the chief sponsor of the telehealth bill that passed through the General Assembly last year. Why was it important for hospitals and insurance companies to adopt and expand telehealth services?
Well, it was important because access is key. And House Bill 3308 provided just that. It opened up more access to not only the African American community, but to all communities regarding telehealth services, being able to connect with your primary care physician via communicative devices, whether it's FaceTime, whether it's Microsoft, whatever avenue that you were using as far as your technology, your mode of technology to be able to communicate like we're doing now through Zoom. You're able to talk to your primary care physician via Zoom. And one of the most transformative experiences that I've had to see it before that bill was passed was I was able to sit in with a parent and her child for La Rabida and all the things that she had to go through to be able to transport her child to the hospital to get treatment, but yet the doctor was able to do those same type of treatments via teleconference and make the child more comfortable in that setting. It was transformative. And then to be able to expand not only that from the physical standpoint, but now you're able to talk with your therapist via technology. That was key. So the most important thing about that bill was it expanded access. So there, and you got to think, we're in the midst of a global pandemic. You have people in fear. They didn't want to leave their homes because they had the mask up, wearing gloves. They didn't want to be around people. So this was an alternative for people that were fearing from the pandemic, and also people that haven't been to the doctor. Now they can talk to their primary care physician and now get the treatment or the support they needed that way as well. So overall, it was just great because it expanded the access to opportunity in healthcare on multiple levels, the physical level and the mental level.
Great answer. And it really is the intersection in healthcare and technology. And that bill really embraced that intersection. So again, wonderful bill, huge impact on underserved communities as well, right? Whether it's an urban hub or a rural hub, it was access is what you spoke of, and that's huge. Senator Sims, we know that telehealth services were important in keeping families or individuals social distancing throughout COVID-19 pandemic. But what else does it help now that we have fewer pandemic-related restrictions in place? Further, why is it important to even continue telehealth services beyond the pandemic?
Just and building on the conversation you were just having with Senator Harris, I think it's important that we talk about this new reality. The pandemic showed us and created a necessary pathway for us to address and accept the realities of technology and how we can then build technology in our everyday lives. None of us could have imagined that before the pandemic, this would be one of our regular modes of communication now, doing Zoom meetings. This is something straight out of the Jetsons. And when we were kids, we didn't know we'd be communicating this way. But now this gives us the way to accept this new reality and to look at where we are and how we are going to move forward. Because as we keep talking, one of the things we've been talking about today is about, one of the things we've talked about is access. When you have telehealth and you're able to engage in telehealth activities, it allows for someone to access healthcare in a way and in a manner that in a space where they're comfortable. Imagine being able to see your primary care physician from the comfort of your own home where you are comfortable. Because there are still some folks who don't believe that, while the pandemic restrictions are ending, the pandemic is still not over. We've moved into an endemic, but there are still folks who are getting COVID-19. There might not be as many people dying, but there's still people who are getting COVID-19. I just came from a conference where the conference had to move partially virtual because several people came down with COVID. I've got a family member who just contracted COVID. I've got another colleague who just contracted COVID. So we're still not, this is still not over. So we've got to be mindful of that. But having then the work that the Senate and Senator Harris and the Senate Insurance Committee have done to invest in increasing and expanding telehealth services, it allows us to move into this new phase and this new reality where we can access healthcare in a totally new way, where people can be encouraged, as we've been talking about, to engage and to work in providing themselves access to those healthcare opportunities to make themselves more healthy.